Tamika obviously has been hiding this pot eating addiction for many years, never brought it up to a doctor before. Question is she doing damage to her body? We sent her to a doctor in her hometown, gastroenterologist Dr. Pradnya Mitroo, for a visit.
We're here at the Advanced Diagnostic Testing Center with Tamika. So our goals today are, number one, to try to figure out why Tamika's having these cravings. And number two is to figure out whether eating the clay pots has caused any harm. Can you describe to me what your symptoms have been?
I've just been really having stomach issues.
Have you had any fatigue since this started?
I have a lot of fatigue.
Do you have trouble concentrating, memory issues?
I do. I have all of that.
Where do you usually get these pots?
From the store. Usually I'll just go to their garden area and get them from there. I actually brought some with me.
Okay. For me, the biggest concern here is lead poisoning because we have no idea what's in these clay pots. There could be any type of metals in there, lead and mercury. So we need to find out if she's being poisoned by these. Is there discomfort here when I'm pushing? Lower down. I think that you have a disorder called pica. Basically what that is a craving to eat substances that don't really have any nutrition. Clay actually has its own term called geophagia. It may be because of some type of deficiencies, most commonly iron deficiency. So the things I'd like to do is to check your iron levels, do a heavy metal screen to check for mercury levels, and then I'm going to set you up for an endoscopy to make sure that there are no ulcers there. We're in her esophagus now. There is a lot of fluid sitting there. It suggests that probably her stomach's probably moving a little bit slower than what it should. There is some irritation in the lining of the stomach. Here you can see small erosions. I'm just going to do a biopsy just to make sure that there's no underlying infection there. So we're going to send the biopsy off for pathology now, and then we'll be getting the blood results for her iron levels, the lead, and the mercury. Okay, we're all done, Tamika.
Dr. Mitroo joins us now just a few days after that appointment. Obviously, everyone concerned about her health. What did you find?
The endoscopy actually looked good. There was some mild inflammation there. The biopsy looked fine. There was no infection. There was nothing to be worried about. And the good news is that the lead level was actually normal. The thing that was very abnormal was actually your iron levels. You essentially have no iron stores in your body. The level was 1. They can't calculate 0, so it's 1. And your hemoglobin, which is the blood count, is about half of what it should be. Normally for a woman, it's 12.5. Yours was 6, which is pretty critical value.
That explains the fatigue for sure.
Yes, the fatigue, the headaches, the listlessness, all of that you can attribute to the iron deficiency.
So is it fair to say, and you have evaluated her, the most important step right now is medically treating her iron deficiency anemia?
Yes.
And so you've been robbing your body of the nutrients it needs while giving yourself things that we know are potentially dangerous. So the first thing is going to be this needs to be addressed medically. And I want you to hopefully, by coming on our stage today, no longer be afraid of your relationship with the doctors in your life, because this can be addressed. And if you are on iron, this is important. Anytime anyone's taking any medication or supplement, if it's not agreeing with you, there are ways to work around that. You're a gastroenterologist, yes, and constipation can happen with iron supplements.
It's very common, but there are other ways. So we can do iron infusions, and that's what we will do. We'll do iron infusions to get these levels up.
Tamika, you look so relieved. Do you feel like you're getting answers now?
I do.
I see the tears, you know, they're sort of quieting down. You look like you were really scared to get those results, and you sort of dodged a bullet. So that's really good news.
Yes.
That you haven't hurt yourself that much yet,
yes,
and that there are solutions here.
Yes, I feel a lot better. Relieved.
But Dr. Dow, I want to address the psychological component, because this has become such a compulsion that even if her iron levels improve, her anemia improves,
it's a habit.
So what can we do on that end?
Yeah, so Tamika, I'd like to offer you 8 sessions of psychotherapy. Cognitive behavioral therapy helps a lot with this, because even with the iron addressed, sometimes it is that psychological habit, right? Yeah. So I'm in those therapy sessions, I will teach you some behavioral replacement therapy techniques, some relaxation techniques. Okay. And you know, they say in addiction, you're as sick as your secrets. Again, I just want to applaud you. You took a very big step today by coming out and saying, this is something I'm dealing with. It doesn't have to be a secret.